I think it's time.
Good afternoon, everyone. Welcome. Thank you so much for being here today. Welcome to the Gerontological Society of America's Grant Chat, Funding Your Research, AHRQ and PCORI. I am Dr. Gail Towsley. I'm an associate professor at the University of Utah College of Nursing. GSA's Grant Chats are a series of 1-hour virtual sessions designed to bolster a broad range of grantsmanship skills, specifically tailored to your work as a gerontologist researcher. GSA Grant Chats feature panel discussions with peers, experienced researchers, and leaders in gerontology, and offer the opportunity to connect with and learn from a wide spectrum of experts in aging science. Today's Grant Chat explores the Patient-Centered Outcomes Research Institute, PCORI, and the Agency for Healthcare Research and Quality, AHRQ, which provide substantial resources for healthcare research in the United States that can help grantees to advance their research missions and improve healthcare quality. AHRQ and PCORI each have their own missions along with specific criteria and objectives that applicants should know to maximize their chances of successfully applying and attaining funding. GSA members and invited speakers with expertise working with PCORI and AHRQ from the inside and the outside will discuss their insights into these funders. Before we start today, I would like to provide a few logistical considerations. First, please introduce yourself in the chat, and please use the chat box throughout the presentation to comment or ask questions. Please keep your audio muted until it's time for discussion. The Grant Chat is being recorded, and you probably saw that little pop-up, and will be available after the event on the GSA website. I am joined today by my esteemed GSA member colleagues, Dr. Zachary Baker, Assistant Professor, Edson College of Nursing and Health Innovation at Arizona State University, and Dr. Patty Slatum, Visiting Scholar at GSA and Professor at the Virginia Center on Aging, Virginia Commonwealth University. We will all serve as co-moderators and are part of the work group planning these sessions. So on that note, I'm going to turn it over to Zach.
Thanks, Gail. To open today's Grant Chat, I'd like to introduce our panelists. So we're delighted to have a distinguished group of GSA members with us to share their perspectives on AHRQ and PCORI as potential funding sources for your research. Our panelists have experience writing successful applications to AHRQ and PCORI, as well as experience from inside AHRQ. First, we welcome Dr. Nicole Brandt, Professor, Department of Pharmacy Practice and Science, and Executive Director, Peter Laramie Center on Drug Therapy and Aging and at the University of Maryland School of Pharmacy. Next, we welcome Mr. Brent Sandmeyer, Program Officer, Social Science Analyst, Agency for Healthcare Research and Quality, which we keep referring to as AHRQ, Center for Evidence and Practice Improvement. Next, we welcome Dr. Jennifer Chia, Professor of Population and Quantitative Health at the University of Massachusetts Chan Medical School and co-lead of the Investigator Development Core for the U.S. Deprescribing Network. Dr. Chia is stepping in today for Dr. Kate LaPlane, who was unable to join us as a panelist today, but assisted quite a bit in planning today's session. We look forward to an engaging and enlightening conversation, and I'll turn it back over to Gail.
So we're going to go ahead and start with our first question. And so for the panelists, if you could briefly describe your AHRQ or PCORI funded research and tell us why was this funding mechanism a good fit for you?
Sure, Dr. Towsley, I can take the first one. So I first want to say a warm welcome to our listeners that are out there. I see the chat in the box of where you're coming from. So as mentioned, Nicole Brandt from the University of Maryland. So we are currently 1 year into a PCORI funded project. Our granting mechanism from PCORI was from the Eugene Washington Engagement Awards program. Currently, they have an open LOI. So if you're interested, And the program is, as PCORI has noted, a patient-centered outcomes research institute. As so eloquently stated by Dr. Baker, I'm a faculty member who works for the University of Maryland at the Lamy Center. And the Lamy Center has a strong standing history of working with our communities, both locally and nationally, and also internationally, to improve medication use and safety. And I say that because PCORI's a really important part with PCORI, and especially with an engagement award, is that you have existing relationships with partners. So this particular engagement award is focusing on creating an elder care medicine network. That wasn't the original name of it, because when we created the grant, and I say that because if you work in PCORI funded projects, you have to be mindful of engaging your stakeholders. So we have a community council. And the intent of this network is to bring together patients, namely older adults, caregivers, researchers, and pharmacists, to discuss PCOR. And the ultimate goal is to engage them in PCOR. We've completed a first-year needs assessment, and also to engage them in creating a research agenda. So we're working with colleagues at the University of Hawaii that we had done pre-existing work with on some of our other grants, working with colleagues from the Midwest at the University of Illinois and the University of Minnesota, also pre-existing work through some of our geriatric workforce enhancement program, and a non-for-profit called Patient Priority Care. And then we're located in the Mid-Atlantic, so we worked with our partners in the Mid-Atlantic to establish this work. So, so a key thing, and we can talk a little bit further about PCORI, but again, is really working with your partners to both develop the grant, but also to work collaboratively with them to execute the grant. So it's really been a wonderful opportunity. And I know that we've looked at other PCOR funding, and we got recently awarded at the University of Maryland a program focusing on bone health as part of our HIP studies through the School of Medicine. So, and then we have a very strong affiliation with PCORI with our patients program. So the University of Maryland and the Lamy Center in particular that I direct has strong work because of our community-based and our affiliations with our partners. So that's a little bit about our PCORI angle, and I'll let the other panelists discuss.
Sure, thanks, Dr. Brandt. So I'm Dr. Jennifer Chia at University of Massachusetts Medical School, and my research mostly has focused on medication safety and generating interventions in the healthcare space to actually improve medication safety. And I work with a large group of geriatric researchers, also pharmacoepidemiologists here who are like-minded in that same space. And for that reason, we have actually availed ourselves of AHRQ funding to fund a lot of those projects. And some of those projects have included, for example, a program called Translating Research into Practice, or TRIP, where we took AHRQ-funded products and evidence and then brought them and translated them into practical implementation in nursing home settings to actually bring the evidence to the front lines and try to improve patient practice that way. AHRQ is really a great fit for this work because they have been and continue to be very interested in patient safety and also medication safety. They have also traditionally been and continue to be interested in the use of technology and IT, and have been great funders of our work in terms of building and working with electronic health record systems in the patient safety space. So we've had great success having our work funded to really implement practical safety interventions at the front lines. And I think when I think of AHRQ, I think of health services research and really practical evaluations of healthcare service in the real world. The other thing that they're interested in, and my team is actually preparing a proposal about this now, is accessibility and affordability around care delivery and financing. And they're a great funder of really those policy and how do we fund the health services research work to improve care delivery from a financing point of view. And so for those projects, we've had success funding really secondary data analysis with large administrative data sets, and they've been a good partner in that work as well. The last thing I'll say about AHRQ is I'm curious to see if they're still doing this. I'm really grateful that Brent is here. We've had a contract under a limited competition network that AHRQ has created in the past, and that was to do work evaluating actually AHRQ tools, and that was in particular a project to evaluate medication adverse drug reaction checklist, and then to get some cognitive interviews and usability surveys to see how we can make that better. So those are just some of the projects that AHRQ has done, and we'll continue to fund. But I'll just turn that back over to everyone else here.
Thank you. I feel like you just took everything I was going to say about AHRQ, but yeah, but I think your comments really spoke to AHRQ's breadth of interest. You know, our mission is to produce evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable, and then to work with other partners to make sure that evidence is understood and used. And I think that last point is really important in understanding AHRQ's role is really that sort of applied nature of a lot of the research that we do. You know, AHRQ has a long history of supporting research in the aging space. You know, whether it's in an institutional setting or community setting, lots of work around patient safety, as you mentioned, but also understanding everything about how care is organized and delivered and paid for, as well, and which policies support the integration of or the translation of evidence into practice as well. You know, I think you know, part of this webinar is to sort of distinguish different funders as well. So you know, I kind of think about National Institute of Aging, PCORI, and AHRQ in sort of some general buckets. You know, NIA having a focus often on specific diseases, developing medications and treatments. PCORI evaluating, you know, sort of treatment A versus treatment B, although I know they've expanded quite a bit over the years into more of a little bit of a AHRQ space. And then AHRQ, you know, taking a whole person focus, thinking about integration and coordination of care, thinking about systems and processes of care, you know, how that care is organized and delivered, getting evidence into practice. AHRQ is mandated by Congress to focus on what we call priority populations, one of which uses somewhat outdated language, but around elderly populations is one of our key populations. But you know, strong interest in aging. One of the areas that we've really focused in on in recent years is people with multiple chronic conditions. And obviously, as we all get older, we tend to develop more and more conditions that need to be coordinated, ideally in a primary care space that can help prevent things from getting worse and help coordinate across the many specialists that folks have as they manage their care journeys. So we have a lot of different funding opportunities that we'll probably talk a little bit more about as we get going, but just wanted to provide some of that initial framing about the agency and some of the work that we offer.
Thank you so much. So I just have a brief follow-up question to that first question is, do you also perform research that is not a good fit for either of these funders?
I guess I'll go first again, Dr. Tousley. We do. Like many, I think, on this call, especially Dr. Tija and I were just chatting before, we're both funded by NIA, the National Institutes on Aging. And as Brent mentioned, some of our work is more quantitative in nature. So using large data sets, not that can't be potentially funded by these other agencies, but I know some of ours is we using large claims data sets, focusing on especially Alzheimer's disease and management and medication safety, especially in long-term care, is some of the work we've been doing with NIA funding. And I know that Dr. Tasia and I get to collaborate together on the USD Prescribing Research Network, which is actually really about building infrastructure and future researchers like you all in the area of aging, focusing on deprescribing medications and medication optimization. So those aren't traditional methodologies that I think would be necessarily, though I would defer to Brent to expand on that, by PCORI or AHRQ per se.
Well, thanks, Dr. Brandt. I can say that I think we all know that to maintain funding, you have to have a bit of a breadth of a bit of a wide portfolio to hit a couple of different topics. And so I also have funding from the National Institute of Nursing Research to look at caregiver engagement and the impact of structural racism. And, you know, the nice thing about the NIH, and I think Dr. Baker was just telling me there's 120 institutes. There's a whole breadth of different types of topics you can avail yourself of. And so I've had previous research funding from the National Institute of Minority Health and Health Disparities to really focus on the racial and ethnic disparities. And not to say that AHRQ isn't interested in that, but sometimes what you lead with or what your primary outcome is might help direct where you want to align your proposal.
Yeah, I think there's a lot of overlap between funders, I think, but it is important to, identify the best fit, and it's not necessarily sort of the agency or funder itself, but the funding opportunities. So even, within AHRQ, for example, we have a couple of dozen different active funding opportunities, usually at any time, that have different focuses and sometimes different sources of funding within the agency. So, for example, Dr. Tasia mentioned, our interest in digital healthcare research and health IT, and they may have some specific funding opportunities around that. So if your study idea has aspects of that, that may be something to target specifically. But I think, shopping around is important. Don't get maybe your heart set don't get too set on one particular funder, because they may not be the best fit. And you should look around and talk to different program officers about, what's active, what is of interest, at least on the government side of things, maybe a bit less with PCORI, which is outside of government. Our priorities change with administrations and with our annual budgets from Congress. Yeah, I mean, to some degree, we always have sort of our core, but things change, and obviously things come along that are unexpected, like COVID, where all of a sudden we were funding lots of research around COVID and infectious disease and things that perhaps we wouldn't have as much of a focus on if it weren't for, this national crisis that we were facing. So, don't be discouraged if something's not a great fit, or, it may not be a good fit at the time, but maybe it'll be a good fit in a couple of years if there's a new, some changes in where our funding priorities are.
If I could, I'll bring in a couple questions from the chat from our participants, and I think you might have begun to answer those. Mr. Sandmeyer, it's interesting to think about the fit is what's important with the call. And so the first question was, does either PCORI or AHRQ fund qualitative research? And I'm imagining both of them do for some calls, right?
Yeah, absolutely. I mean, I like to say AHRQ is somewhat methods agnostic, in that peer reviewers will be looking for the best fit between the proposed methods and the goals of the study. So, obviously, qualitative research is very important for a lot of things, and AHRQ sees a lot of mixed methods research as well. And so looking for the integration of those methods to meet the study aims. So, things come in purely qualitative, purely quantitative, mixed. So just having a good reason for using the approach that you're proposing is the most important. And I imagine it's the same for PCORI.
Yeah, and we had another question, which I think your answer also answers that question, which is, would AHRQ or PCORI have interest in funding evaluation using random assignment to assess the impact of something like a music intervention or some kind of non-pharmacologic intervention on stress levels of family caregivers? And it seems to me that this, again, if it's a good fit for the call and there's good justification for the method, that it could apply, right? So the idea would be to talk to the program officer to find out more and to read the current agency calls and priorities. And I'm assuming that's going to be available on the website.
Yeah, this, if I might respond, others might have thoughts on this as well. For this particular example, I would say that AHRQ's research is focused on the healthcare sector. So not necessarily sort of general health. So in this case, what we would probably look for is, you mentioned caregivers or stress level of caregivers. So what we'd be looking for is probably some, outcome measures in this reflective of the healthcare system. So like, for example, does implementing this intervention, help people from, keep them out of institutions or having to, have readmissions? Does it help reduce healthcare costs? Does it help, some kind of connection back to the healthcare system versus just something to reduce stress of an individual in general?
And thank you so much, Brent. That's helpful. The last time I interacted with AHRQ was my dissertation grant 15 years ago, where I think Jennifer, we may have crossed paths at Penn many years ago. And so I'm a newbie, certainly in the sense of considering AHRQ, PCORI, or NIA. And so kind of getting a sense of that is helpful. To give a little bit more context, I'm a health economist by training. I'm very much in the health services research world. I've joined a team that's developed this random assignment. We have about 100 caregivers currently enrolled. It's funded by the Retirement Research Foundation. And if the results are promising, we'll have pretty solid pilot data comparing intervention A versus B. One is a stress busting program. The other is music intervention, combining the both. And so it sounds like PCORI or NIA would potentially be a better fit. Are there subtle differences between PCORI and NIA for those of you who sit on study sections in terms of maybe the emphasis in the review of a PCORI proposal versus an NIA proposal? Thank you.
Thank you. Yeah, thank you, Dr. Glenn. I'll take a first stab at this because I have actually sat on PCORI review panels before, and I have thought about these type of interventions in this population of caregivers. And I think Dr. Brandt actually brought up one of, I think, the key important issues right now, and I think it won't go away for PCORI, is the stakeholder engagement and involvement. And I think they take that very seriously. And you have to, I think, as a reviewer, they very much, well, first of all, if you don't know, I think most people know, there are stakeholders, so non-scientists actually on the review panel. And they do review the grants, and they have a very specific way of reviewing the grants. And their input and evaluations are just as valuable as everyone else's. And it's very important to show, strength of the relationship with your partner. And so prior work together, creating partnership in how the grant is put together, how the intervention is put together, or let's say the counterfactual would be we put this all together and we just invited the stakeholder at the last minute, that would not really fly very well. The other thing that it really have to consider is adequate budgeting for the partner at all stages. So in the engagement, how you're going to engage with them when you meet, and Dr. Brand can speak to this more because she is actually doing this, but it is much more of a consideration budget-wise, but also development-wise for PCORI. In terms of, NIA or NINR, I think that there's a lot less emphasis on or probably no emphasis on the partner stakeholder engagement, although they will welcome it, and that sort of has creeped in to the NIA grants. But it's a different ball game, and I think NINR might be a possible interest in caregivers. The other way that I think about these things is that if the real thing is to look at the intervention, is it music, then to really consider, does that fit into maybe some complementary medicine type of calls? But I'll stop there and see if Dr. Brand has anything else to say about PCORI.
Yeah, thanks, Dr. TJ. That was outstanding. But just to expand upon that, absolutely, as I stated at the beginning, PCORI is looking from ground level development of your proposal. What is the engagement of the stakeholders, and how, to the angle of budget, how are you reimbursing? Now, no one ever wants to talk about reimbursement. It's probably one of those less than discussed topics, and we can always take that offline. But it's important about adequate inclusion of stakeholders, diverse stakeholders, I think is also becoming very noteworthy, to make sure that we're representing underserved communities. And there's different ways we describe that. So that's why, for us in the Mid-Atlantic, we're not as rural, we're very urban. So we partnered with Hawaii, which is very rural. Learned it was the best place to live in the US just recently from a call for lots of reasons, and one of them being healthcare. But then to the Midwest, where there's a lot of underserved communities, especially in Chicago, where we're focusing in our work is really focusing on the pharmacy and pharmacist. So there's a lot of pharmacy deserts that are emerging, even though it's an urban area. And we had pre-existing relationships, and it's important to note that as well. So I think, and then what we've learned from our discussions with PCORI, both through our funding, but also our work with the US Prescribing Research Network, is the review process. And so we're currently writing a paper on the whole review process of stakeholders and their voice being as strong as others' voice in that review process. So I think there's a lot of opportunity to continue. I think it's also important when we think about not just the intervention, but the outcomes, is having a discussion. And recently we put in a proposal to PCORI, and our stakeholders were very informative on what outcomes are meaningful to them. Like you heard people talk about hospitalization and, emergency department visits. For our stakeholders, they were expressing that it's not just about those outcomes, which might be healthcare centric, but the burden in this particular proposal was on medications, the burden and cost of medications, the access of medications might be some other things that we think about differently. So, and showing that and expressing that within your proposal is really critical. So that's what I've noticed quite differently, unlike our NIA submissions, where we've done similar kind of work, but it's more focused on what's the evidence out there, what has been proven, what hasn't been proven, and not as much stakeholder engagement. So those are just my experiences. Brent, I don't know what you want to add to that from an AHRQ perspective.
No, I think you all covered it as best as I understand it. I can't necessarily speak to their specific review processes, but I think you're going to see similar differences between PCORI and AHRQ as well, as far as looking. While we definitely appreciate patient engagement, stakeholder engagement, it's less built into sort of the review process and the requirements generally of our application.
I'd like to pose the next question to you, Dr. Chia. Say I've heard this presentation, I've decided I'm going AHRQ. What are the first steps that you take when you're preparing an AHRQ application?
Yeah, no, I appreciate that question. Thanks, Dr. Baker. I think well, it's particularly when I'm thinking about AHRQ, I always think about the alignment question, which has come up a lot in this. So who's the best person or the best institute for this? And so, for example, we're actually submitting something to AHRQ next week because it was really this question about evaluating a health policy and the economic impacts on medication safety. And so while we could have spun this as how is this policy affecting medications, maybe NIA might be interested in medications, it really just seemed like much more of a natural fit for AHRQ and what their stated objectives are. And when you think about fit, I think there's a couple of ways to think about fit. Maybe I'll start this conversation. One is if there are any, first is the research priorities of the institute or the agency, which do change, right? They tend to change, like NINR just changed theirs like in the last year. So you should check with those. I think the second way that you can think about it is if there are any RFAs out there. So the difference between an RFA and a PA is an RFA that's actually earmarked money for that question, usually time limited, right? A PA usually speaks to the more general interest of the institute, but there's not necessarily earmarked money for that. And so you weigh that as well. And then the third way to think about fit is in terms of who's going to review your grant. So the other thing is the AHRQ reviewers are really focused on, health services and are maybe much more attuned to maybe the dollars and how that all puts together. And not that there are health economists on other NIH sections, but it's just a little bit different. So when I think about fit, I think about those three domains, and then I think about my team, and then I think about, where we're going to go. I know a lot of people start with talking to the program officer, and I just want to put that out there as that's very strong and common recommendation, and I'd love to hear what Dr. Brandt thinks about that, and actually, Dr. Sandmeyer, what's the best way to use that conversation to help target and start your process?
Fantastic. Jen, I love your framework. 3, the adult learner remembers 3 things. So that was fantastic. Yeah, I think it's imperative. And especially I know for the group that's on here, a lot of us are focused on gerontology and geriatrics. So there's oftentimes known relationships within these program officers, and we meet each other at meetings. And I think especially for some of our junior investigators that are on this call, networking is critical. I remember when it was before an RFA was coming out, there was kind of some buzz going on. So we got to have that kind of conversation regarding, for in this particular instance, deprescribing. So I think it's wonderful as you get to develop those relationships and ask honest questions. I think that's really helpful. And then cultivate that relationship, for someone who's newly funded with PCORI, for instance, we just met with our project officer last week and said, what do you think about this? And she's like, yeah, not really, so it was wonderful. It helped save time. So, so having that, open discussion and dialogue and being, realistic of what you can and cannot do within your facility and your partners and your strengths. And I think that's really, as a director of a center, I have to take a step back. What does our team do well? What do we not do as well? And not really put us outside that scope. But if we partner with other organizations who may have those other strengths that are weaknesses. So I was always trained and mentored, identify your strengths and identify your weaknesses and partner with others that have their strengths are your weaknesses, and you'll do really well. So I think that's really important to think about your own reflection. And I think there's been a lot of, I think this conversation came up earlier, just in terms of the methodologies and being really clear, because I know people are getting more involved in mixed methodologies, but are you really good at that? Because I know that was a criticism we had on an AHRQ award that we put in terms of some of the limitations. So I think we're always learning, but to really kind of identify those priority areas, I think someone asked that, and I think Brent put some additional information. So I don't have much more to add than what was already expressed.
Thanks. Those are great points. Yeah, and you know, I say talk to a program officer or whatever, you know, which is really important, and I totally encourage that. But it's also important to think about sort of when you're ready to do that. You know, I always encourage people, you know, do your homework first. You know, take a look at what announcements are open right now. You know, is there something you're particularly interested in? Often there's a specific person associated with those announcements, so that can help you narrow it down right there. I just shared in the chat for our general announcements, you can take a look at our special emphasis notices, which also have people associated with them. But you know, for this group, we have some areas of interest like optimizing care for people living with multiple chronic conditions through development of enhanced care planning, things like that. You know, identify those can be helpful for sort of tracking down, you know, the right person to contact, as well as just getting a sense of, you know, what's the agency interested in right now, and having a little bit more of a concrete idea. You know, if you come in to me and just say, you know, is AHRQ interested in research on aging or something like that, that's not really a helpful conversation, and doesn't really help me direct you to the right person or to the right opportunities and things like that. So, you know, think about sort of when you're ready to have those conversations. And I would also say on sort of the other side, you know, we're as organizations, we're not stagnant. You know, we're always looking to you in the field to, you know, inform our research agendas. And you know, before I forget about it, just want to share in the comments as well. You know, we have a request for information out right now on person-centered care planning for multiple chronic conditions, looking to see, you know, what innovations are you familiar with in these areas. So, you know, please take the time too to provide feedback to the funding agencies when they put out calls like this, because, you know, this is the feedback that we use to develop funding opportunities and to help shape our research agendas. So, you know, not just taking that passive role, but, you know, help tell us what to do and shape our research agendas beyond just, you know, your individual proposals. So that's always an opportunity there as well.
Thank you. Our next question was going to be about switching over to kind of the PCORI side, but I think Dr. Brandt, you gave us a lot of insight there. So unless you'd like to throw something else on top of there that's specific to PCORI about how you get started.
You know, I would, especially because I know we have the spectrum of investigators on this call, you know, even listening in to some of the discussions on program announcements, to ask some general questions, I think is a great place to start. And then to reach out to others. I know GSA has a meeting coming up, as I tell my trainees and others, is be strategic in your circulation around the poster sessions to learn more, because I think we all have different experiences there, and there's different funding agents or different funding calls. And just to think about, you know, especially when you're putting together your research plan, you know, if this doesn't work, what is your backup plan? Because you put a lot of energy into these proposals. So I think that's important too. But yeah, but I think it's just really talking with others, getting in additional experience, but being mindful that PCORI does put a lot of information out there. I personally find, you know, for those of us who've submitted PCORI grants, they're different too, in terms of the format, and we have to go through a particular website and formatting. So it's every program has its unique aspects. I don't want to say nuances, but different aspects. But there's definitely want to make sure you look at their checklist. Because I was a little surprised at first about some of the questions that I didn't normally see in some of my grant submissions. So make sure you do your homework and looking at all that they're requiring. So just some additional aspects. So thanks, Patty, for Dr. Sladen for plugging that in, because I think those are really important as you're starting to explore these opportunities for funding.
Yeah, and I like Dr. Brandt, your focus on sort of long-term planning as well, because especially with government funding, it's an incredibly long process. And you know, often people don't get even great applications don't get funded the first time around. You'll resubmit things. I mean, so we're talking about, think, years, not months. Is your application still going to be sort of fresh enough, a year from now? Are you going to have access to the same data, same population? So thinking a little bit ahead is good. And then also, I wanted to point out for folks who are not as familiar with federal funding or AHRQ funding, that the grants are made to your institution generally, not an individual. And so, working with, if you have a grants office in your institution, work with them to make sure that, they're prepared to, support you in your application, getting you all the materials, all the budget information, all this kind of stuff that you need. And frankly, not every institution can support federal grants. If you haven't had federal grants before, it's a steep, it's very much an uphill battle to get into that world. And so sometimes it's better to partner with an academic institution or something like that that's really set up to handle federal grants, and work with them to try to secure funding.
These are great comments, and also a great segue to our next question. So in addition to making, checking in with your institution and long-range planning, what tips for success do you have for preparing successful grant applications? So let's go ahead and start with preparing an application to AHRQ.
I'm happy to jump in. I think, and this is a point that Kate brought out, so for Dr. LePan, who couldn't be here, so I wanted to share that with you. Having the right team, this is a team business and team science. You have to have the right team to go in and to prepare something that will not only be as strong as possible in its presentation and as rigorous, but also as strong as possible in its implementation. And you sort of can't emphasize that enough. One, for the scientific reasons, but two, for the review reasons. So what do I mean by that? So when I was at Penn with Dr. Gloom a long time ago, I spent a lot of my time at Wharton learning a lot of health economics. And so I can write a pretty decent health economics section. But if I were to submit a grant without a health economist on it, that was primarily going to argue that we're going to do that. That would not be convincing. And so you need to have a team that is going to bring forth their reputation, their expertise, and their rigor throughout the whole thing. And so having the team is a great place to start once you have the preliminary studies and the idea.
Yeah, I think that's spot on. I mean, you can have a great idea, but if reviewers have concerns about your ability to actually get the study done, that's really going to drag down your proposal there. And certainly that has to do with the people, but also sort of just the structure and experience as well. I mean, the reviewers will look at things like, have these people worked together before, or if you're proposing to do, recruit a bunch of patients in a hospital, do you have any experience working with that hospital or in that setting? So just, thinking about, does your personal experience, does the experience of the team sort of support the size of the application that you're coming in on? Because at least at AHRQ, we offer a wide range of things throughout the opportunities throughout the career from, sort of the doctoral or even pre-doctoral level type of grants to early career to mid-career training, as well, in addition to all of our sort of standard research, standalone research opportunities. So, and sometimes those opportunities actually provide more funding and more support than our sort of standalone research studies. So just, again, considering all your options and thinking about where you are in terms of your career and your experience, as well as the team. And there's lots of ways to sort of get around some of these things too. Who serves as sort of the lead, the principal investigator. Are there things you can do, like put together an advisory team of people who might have more experience in areas that you're lacking? Because you can, especially when you have these sort of multidisciplinary studies, often the funding is not there to support people from all these different backgrounds. So thinking about how do you get that expertise without spending a ton of resources that you don't have, in a way that can give reviewers confidence that that expertise is there, that you have access to the settings that you're trying to approach, the populations that you're trying to include, all these kind of things.
And just to add to that, I think was eloquently stated. In addition to team, which starts with a T, tenacity and perseverance, because it will be humbling. I think we have like a support group amongst researchers at time on the feedback you get. And to Brent's point, as much as you can, having advisors that can guide you in this process is really, really key to a successful grant application. And as articulated already, if at first you don't succeed, try and try again. You invest a lot of time and energy into these grant applications. So it's important that you think about that for the future. I just also want to bring just, some experience to light. Make sure to pay attention to small details. I'll always remember an AHRQ application and the references. It was the last minute we were focusing on references because we were so focused on the science and making sure our methods were solid. And then it was like, oh my God, the referencing. So it may sound so simple, but a small blip could derail the submission of a timely proposal. And the other thing, and I think it was articulated, is making sure that you have your business office budget team on board from day one, because there's always changes. And it might be, again, simple derailment that you're using an old biosketch form for, and so I just have to say it takes a team, and it's not just your scientists or researchers, but it's your business office, it's your grad students, it's everybody meeting. So just give yourself time, because no matter how much you pre-plan, you're going to find yourself that last minute trying to make sure that you get it in on time. So I think that's really important. And I know as an institution have built in sometimes so that if you get an error message that you have time to fix it. So I know those sound like simple things, but if you want to be successful, attention to details is going to be paramount.
I just wanted to jump on that comment or jump on to add to that, Dr. Brandt, because the PCORI world in particular, there are so many details that are so different. And at least when I was trying to get hit on PCORI, they like changed almost every cycle. And I don't know if they've settled down or not, but literally, I thought I had everything. I have to tell the story because what Nikki says is so important. I thought I had everything. And I'm a last minute person. So if you're not a last minute person, you can just turn this off. But literally, we were going to hit the button. We hit the button. We got the error. The person hit the button for me, said, "You're missing this form." I'm like, what form is this? And long story short is we missed the deadline after all that work. We really did. So it does happen. So building those time and especially for PCORI, figure out what all those details are because they always change.
You're spot on, Jen. Thanks for sharing. You're spot on. And I, even just with the LOI that we were going to put in, they changed. So, and then they have this PCORI Force site, which, is not intuitive. And it's also different, we've got funding from others, but you're getting reimbursed based on meeting deliverables. So it's very, very time sensitive. So you've got to be mindful when you're creating your workflow that you're going to be realistic in your deliverables. So, or you won't get the money. So that's also a key aspect of this that's a little different than other grants we've had.
I'd also just say, just put in a plug here. We're always looking for peer reviewers, depending on where you are in your career, you may or may not be eligible for that, but there's nothing like sort of seeing the sausage getting made, if you will, seeing what happens in the background to get a better sense of, what are reviewers looking at? What are they spending time on? What do they focus on? And so just would encourage folks to throw their names in the hat if you're at all interested, and if you feel like you're in a sort of position in your career to help us review all those other applications.
And to do that, how should people go about reaching out? Should they email you directly? Is there a form online that they can fill out?
There's not a form, but feel free to email me, and I'll put you in touch with the director of our scientific review division here, and sometimes we put out a open call for reviewers, but always feel free to reach out and just let us know you're interested. Or if you have colleagues who you think would make great reviewers, feel free to suggest them as well.
Thank you. So you've all given a lot of really great insight on how you prepare yourself for these applications. The next one, I'm gonna turn to Dr. Brandt first, focusing on PCORI. When I submit an NIA application, I have different heuristics for different mechanisms about how much preliminary data is needed. So R01, I'm going to expect I need a lot more data going into that application than maybe an R21. When you think about a PCORI application, what kind of data do you think about needing to have going in?
I think that's a great question, Dr. Baker. So there's, as it kind of alluded to, and I want to thank Dr. Sladen for populating the chat box with the different mechanisms. So, and this is getting back at your research plan. So being new to being independently funded as a PI for PCORI, we started with the engagement award because it's kind of building blocks. So it gave us 2 years to build our network, to create a research agenda that we co-design with our partners to then do a larger grant, right? So this in particular, so there wasn't a lot of pilot work. What we had to really illustrate is why this question needed to be answered, and really taking a lot of time looking at the agency's pre-existing work in this space and realizing there was a need. And after discussion with some of the team at PCORI, is there was a need to focus on older adults, caregivers, med safety, and really engaging pharmacists as researchers who focus on PCOR. So that's where that whole kind of trajectory, and as we're building our experiences with PCORI, we can then take our pre-existing work and build it into our next proposal, or partner, as we're doing with others, some of our network work with other proposals. So yeah, it really depends on the funding. So you're right, Dr. Baker, that unlike our NIA funded grant, we had a lot of pre-work that we had done as a center with some of our partners that we published and peer reviewed. The others it was kind of, I call it soft science. It was like we've worked together, we got a couple publications, we had some stories of some of the outreach and things like that, but it wasn't nearly as scientifically rigorous. But that's, again, but it's more of a building of a plan for our research plan in this particular space. Hopefully that helps.
Yeah, no, that helps a lot. Thank you. I'm curious, you mentioned going through a PCORI mechanism for the kind of preliminary work there. Did you ever consider alternative mechanisms? Do you think there are alternative mechanisms that could be beneficial there, whether it's something within a state to start building those partnerships, or do you think it is really advisable to try to go through PCORI mechanisms to get a larger PCORI grant?
Yeah, thanks, Dr. Baker. In again, I'll put my MBA hat on as a clinician, research educator, and business person. You've got to have a diverse profile. So some of our work is actually funded by foundation work outside of the governmental discussion we're having today, which then establishes some of our preliminary data. So we've been working with local and national foundations to try to do some of this work. To your point, we've worked with state agencies as well on some of this work. So it's really having those candid conversations as where some other funding allocation besides governmental, because the governmental funding is very competitive. And as a newer investigator might be hard to get that preliminary work funded. So yeah, so that's where our preceding to PCORI work came from, is more from our foundations, our partnerships with our HRSA funded work with GWEP, and then some of the other state work that we've done as a state university.
Thank you so much. You know, it's so interesting to think about how we position our work and head towards getting funding for the important questions we all are passionate about pursuing. And believe it or not, we're at the top of our hour for this session already. And I would like to bring our session to a close today by asking each of our panelists to share a final pearl of wisdom or final comment that they would like to make about their work with AHRQ or PCORI. And we'll start with you, Dr. Brandt.
Yeah, final comment is, I have to tell you, I've been in this space for 25 years, and this has been the most rewarding and illuminating process because it's really iterative. I have to say I'm constantly learning from my partners, both in terms of language and approach. That has been tremendously insightful, both as a clinician, an educator, and a researcher. And that really, for me, has been fascinating. And then the rippling effects by sometimes not controlling as much and how people can really go with it, especially with stakeholder engagement. So I've really, really liked this. It's hard at times because it takes longer and I'm a type A person, but I've really realized the richness and the value that it brings to the communities, especially as I've been working some of our rural communities, which has been tremendous. So yeah, constantly learning, Dr. Slato.
That's encouraging, very encouraging. Yeah. Dr. Chia.
Sure. So thank you all for attending and for organizing this. I think what I'd like to leave with is, you know, this business, particularly the part about writing grants, it's really an apprentice type of profession, meaning that it's only through the wisdom handed down from people who know or have been there or learned the hard way or learned by success, where we all learn how to do this. And so you can never ask too many people for too much help and review and wisdom and strategy, because there's so much to learn out there and it's always changing. So get help, get lots of it from lots of people.
It's fun to do and get help. Excellent. And Dr. Sandmeyer.
Well, thanks so much for having us today, first of all, and thanks you all for joining us. Just want to reiterate that, you know, aging and older adults are a core part of AHRQ's mission and the types of research that we funded in the past, and some of our most impactful and recognized studies have been with this population on this issue. So I encourage folks to continue to think of us as a go-to source for funding in this area. And also we'll just acknowledge that, you know, the federal space is incredibly complicated and intimidating, and just, you know that there's real people on the other side of that, and please, you know, do what you can to make connections with us, and don't be, you know, shy to reach out with questions, and you know, come to me. I'm happy to refer you to other people if I don't know the answer or if there's better people to talk to, but just thanks again.
Yeah, thank you all. And I would say to our participants, as a next step in exploring this topic, take a look at lots of resources have been posted today in our chat, and they will also be included with the recording of today's session on the GSA website. And we would like to thank our panelists for generously sharing their time, their experiences, and their perspectives with us today. We thank also the moderators and work group members who planned the grant chat, and thanks to our participants for your questions and comments, which made for a richer discussion today. And we also have a big thank you to Judy Liu from GSA staff, who did all the behind the scenes coordination that makes this grant chat possible. And with that, we'll send out a brief survey following this event for you to provide feedback and help us to plan future grant chats. And we hope that all of you enjoy the rest of your day. Thanks for joining.
Thanks, everybody.
Thank you so much.